With, as we heard earlier, the number of cases expected to climb in coming weeks, many experts say the next phase in the response to the COVID-19 pandemic will require aggressive contact tracing. Amna Nawaz reports on how tracing works, why it could help, and the concerns over privacy.
Krista Cass's path to medicine was not the norm. A West Point grad, she served 3 tours of duty for the U.S. Army, then went on to become a physician's assistant in Boston. In March, like many places during the pandemic, all elective surgeries here were paused.
We can't operate and replace hips and knees right now. I just kept thinking, what can I do? How can I help? How can I be involved in this public health crisis?
Massachusetts has about 70,000 confirmed cases of COVID-19. And last month, Governor Charlie Baker gave Krista her answer, announcing a new phase in the state's fight against the virus: aggressive contact tracing.
I was one of the first applicants. I could not wait to get my hands on this.
Krista was hired by Partners in Health, a Boston-based global health nonprofit working with the state to hire, train, and deploy 1,000 new contact tracers at a cost of $44 million. The process is straightforward but time-intensive. First, contact all new confirmed cases of COVID-19. Find out everyone they came into contact with while sick. Then reach out to those people to tell them that they may have been exposed and will need to quarantine.
What are the first lines you deliver to people?
I would say, hi, I'm Krista. I'm calling from the Community Tracing Collaborative at the Department of Health. I'm calling to let you know that you've been exposed in the past week to someone who was diagnosed recently with COVID-19. And then I take a break because that's a lot to handle and a lot to hear.
The work, she says, is about more than just informing people they might have been exposed. Contact tracers explain how to quarantine the right way, how people can protect their families, get groceries and medicine, pay their bills, even find help for domestic abuse.
We are not just collecting data. We're doing more than that. We are becoming extensions of our client, of our contact's social support system, and we're connecting them with the resources they need.
Used around the globe in response to diseases like cholera, HIV, and Ebola, contact tracing has long been a critical public health tool to map and control outbreaks.
This is how you stop running away from the virus and start chasing it down.
Now with the Center for Global Development, Jeremy Konyndyk helped manage the Obama administration's Ebola response in West Africa, relying heavily on contact tracing. Ramping up a national program here, he says, could not only help stop the spread, it could also help avoid large-scale shutdowns.
Because of inadequate testing and because we don't have a national contact tracing infrastructure in place in the United States, we in effect have to presumptively quarantine the whole population. But with contact tracing at scale and testing at scale, then you have the ability to quarantine only those people who have actually been exposed to the virus.
Digital tools to track people's movements, he says, like those used in Singapore, Israel, South Korea, and many other countries, could also help. But tackling the scale of infection here in the U.S., on top of years of slashing state health budgets, means more federal leadership is needed.
The estimates now from Johns Hopkins are that we may need somewhere around 100,000 contact tracers across the United States. And I think that that's the sort of order of magnitude we need to be thinking on here. That's a lot of people, but also that's an achievable thing.
Some estimate the U.S. will need nearly double that number of contact tracers, but so far states are largely rolling out their own individual plans. North and South Dakota are 2 of a handful of states which have not issued stay-at-home orders during COVID-19. Together, they've so far seen around 3,500 confirmed cases with fewer than 50 deaths. Officials now hope a new location-based app can aid their efforts to keep the virus at bay.
It turns out that most people, including myself, can't remember on a good day where I was 5 days ago, let alone if you're sick.
Tim Brookins is an app developer in Fargo, North Dakota. In 2014, he developed Bison Tracker, an app that let North Dakota State football fans track each other as they travel together to away games. In April, he repurposed that app into this one, the Care19 app, which tracks and compiles users' locations, so if they do test positive, they can easily share that data with a contact tracer. Brookins says it will protect users' identities while making the process more efficient and accurate, but he acknowledges these efforts require buy-in.
It's hard. People need to really take time to digest, what is the new normal after this, and, come to terms with the idea of location tracking.
Google and Apple recently announced they're working on contact tracing technology too, to roll out in mid-May. But the rushed tech response has some privacy experts worried.
We're essentially building the airplane while it's flying.
John Callis is a former security expert at Apple, now with the American Civil Liberties Union. They recently published a report outlining principles to protect privacy and civil rights in contact tracing technologies.
Among those principles, that the technology used should be voluntary. Tracking information should be stored on a user's phone rather than a government or company server. The data should be routinely cleared out, and these programs should end when the pandemic does.
Callis says these are necessary steps not only to protect the public from increased surveillance, as seen in China, but for public health efforts to fight the pandemic to be effective.
We have to get the trust of the people who are using this. If people don't trust that this is a system that will benefit them and their community, they won't use it. They'll balk. They'll push back. I mean, we already see people in the United States who are pushing back on things.
Ultimately, though, experts agree that digital tools should complement human contact tracers, not replace them.
While the app may be efficient, it's not familiar, nor does it have a human voice on the other end of it saying, by the way, I know I'm telling you that you've been exposed, and the second thing I want you to know is I am here for you through this process.
A process to slow the spread, save lives, and maybe even prevent future waves of the virus. For the PBS NewsHour, I'm Amna Nawaz in Washington.